Welcome to BW Healthcare World. Thank you so much, Ashish, for joining us. For those of you who do not know Ashish, Mr. Ashish Bajaj is the Chief Marketing Officer of Narayana Health. And we have seen Narayana Health rebrand itself. And this conversation with Ashish is around trying to understand what led to this and how it will impact the business of Narayana Health as well as the industry. Welcome, Ashish Bajaj, to BW Healthcare World.
Thanks, Chief. Thank you so much for having us. We're delighted to be part of the platform, and your platform is just an amazing platform for the healthcare industry.
Thank you, Ashish. Ashish, first thing first, what has changed at Narayana Group of Hospitals?
Wow. I think as part of our revealer video as well, the first thing that we have called out is change is the only constant. And over the couple of decades, we have kept evolving ourselves. And the story itself is tremendous in terms from starting from one hospital in Kolkata to where we stand right now. So the change in mindset is about how this brand becomes consumer-centric. How the story weaves around consumer being at the center, and then is all the channels or all the vehicles of healthcare deliveries are constructed around the consumer. So that has been the change, and I am very, very fortunate to be part of that change.
Awesome, Ashish. Ashish, why do you think there was a need to rebrand the institution?
So, Chief, to be honest, yes, we've seen healthcare as an industry for very, very long, and you yourself are a person who's a legend in the industry. But from a point of view, so for somebody like me who is very young to the healthcare delivery model, there is a little bit of nuance change required, because when you look at this industry, it's different from how the other industries have evolved and have become consumer centric. So that solutioning that starts from the consumer was the need of the change for the industry. And this is what it will take forward for another 200, 300 years. And we are happy that we are making our bit in terms of making it come alive.
I can't agree with you more on this because, we've always been talking about creating healthcare services around the patient and calling it patient-centric. I think marketing also needs to recognize this. But Ashish, what is the philosophy behind the new brand that has been released?
So when we started, so I'll take you a little back. When we started this conversation about our brand and how do we position ourselves for long, we started with the point of view of one name, one heart, and one mission. So it just encompasses beautifully all the things that we have been stood for and we want to be known for. Going a little one level deeper onto this, we're kind of we know the healthcare industry. See, it's a place where guests or people or patients in general are not looking at saying that, okay, tomorrow morning I'm going to the X hospital. It's not similar to a lot of industries where we say, yes, tomorrow morning I'm going to go buy this. It's a place where you are already under stress. So it was important that the brand sets up a tone and builds its proposition around giving you context of being taken care of. Right? And that is how we set up our proposition about the newly launched one that calls us about Take Care.
And how has the nomenclature changed?
So nomenclature from an overall brand perspective hits at the mother brand, which is our Narayana Health. And under this, all of our sub-vertical, sub-businesses or extension you may as call, starting from our flagship, which is Health City, our line of hospitals, our clinics, labs, etc. Then all move towards the mother brand. And from a nomenclature at a brand proposition point of view is a very interesting story. And we started from understanding from our patients itself. So imagine our team actually going under and sitting at the hospital and speaking to a lot of patients ourselves. And the major pillars of driving this brand forward, which is our own employees, our doctors, our technical staff, our nurses. We understood from all of them that what is that, apart from getting the consumer information, what is that they look to deliver to the consumer or the patient. And you won't believe it was a unanimous single two words that came out, that from a doctor's and nurse's point of view, they want to take care of their patients. From a patient's point of view, they want to be taken care of. And from our employees' point of view, that is what you want. If somebody reaches out to you to seek for help for their own loved ones or for themselves, etc. And that is how our employees are also, that we want to take care of whoever is reaching out to us. So it was beautiful how all of it came together. These are the simplest form of words which can actually showcase a very strong emotion. And that's how we came up with all the nomenclatures for the brand.
And what is the new brand called now?
So we're calling ourselves Narayana Health, and our proposition is set in tones of take care. So that brings out our emotion, empathy, and also has an output as a trust.
And Ashish, what do you think will be the impact created through this new branding?
So impact, what we are looking at is the acceptance of the services, acceptance of mass audience for us in terms of looking at that we delivering the value which they are looking or expecting. And just by setting up the proposition, if it is not an experiential proposition, fails the entire system. So our effort in terms of acceptance is going to be more in terms of how I experience it with this brand. And I take home that they actually mean what they're trying to say. So that's a journey that we're going to be on, and it impacts the industry so beautifully that we are hoping that the category itself looks at shifting to that kind of module for all of their healthcare deliveries.
And Ashish, I'm also tempted to ask you that you come from a non-healthcare background, and that you have now come in and you're taking a very, very major step in the institution that you now are associated with. What is it that you try to understand about healthcare marketing and how it is evolving to be able to have the courage to make such a significant change?
So first and foremost, it's the ecosystem around you. So the support that you get from your team, who actually give you liquid gold of 25, 30 years of experience into healthcare. They distill that for you, and they try to give you into your induction so that you can speed up your own process. I think that was the lottery for me. And from there we started off our understanding of consumer from my previous experiences, and we try to create a hybrid model, or say a good mix of that, so that we can take such courageous decisions.
And before I let you go, Ashish, my last question to you, and something that I've been meaning to ask you for a long time, and that is, how do you think patients in today's day and age are able to find their doctor or someone that they could have faith in terms of the care that they expect?
So I think we should look at this, how the consumers have evolved in, let's say, last 1 decade. Let's not go beyond that. My way of finding out information has changed and has evolved. And when it is involved, my word of mouth has started moving towards not just being unidirectional, to multiple facets of collecting that information and then making my decision. In that, if I see, earlier it used to be I speaking to somebody and getting much more details about a doctor that I feel can deliver the solutions of my problem, has moved to multiple searches as well, has moved to multiple reading of reviews as well, has moved to reading or watching the reels of the doctor, have moved to how many medical journals his content has been published to, his or her content has been published, move to how many blogs or how much simply the doctor is trying to explain about bigger problems in their videos. So you won't believe the entire healthcare category has around more than 1.3 billion searches every year in India itself. In that, almost 30% of them look for doctor wise content. So that makes a clear call out for all the platform providers to institutionalize the requirement and building visibilities for their doctor bases and even for doctors themselves. So that changes a lot.
Ashish, this is a very beautiful conversation, because it is not just about what Narayana Health is doing, but it also gives us an understanding of where the industry is moving and where the focus needs to be. I mean, you very beautifully brought out that, in fact, when I was talking to you earlier, you mentioned this, to quote unquote what you said, that the person who is the soul of the industry needs to be taken care of, and you need to think of consumer first. And when it comes to the healthcare industry, it is the patient first.
Yes.
Congratulations and best wishes for what you're doing at Narayana Health. I truly believe in what you just said, that change is the only constant and the evolution must continue. Thank you so much for taking our time.
Thank you, sir. Thank you so much for having us.